Maxine Waters of California. Great, thanks once again for your time tonight.
Delighted to be with you. Thank you for inviting me.
One investigation already underway in your state, another under consideration. Let me start with the denial of claims. Is that a criminal investigation there too?
Well, I am so pleased that Attorney General Jerry Brown has decided to take this issue up. These stories we've been hearing for years, people who pay their premiums year in and year out, and then when they file a claim, the war begins. They've got to fight. They've got to do everything to try and get these companies to pay, and then they're oftentimes rejected. This information by the California Nurses Association is extremely important. This is a credible organization representing over 86,000 nurses in the United States of America, and they've finally put the facts before us. That which we suspected all along, that there were huge rejections. This 39.6% of Pacific Care, that is outrageous. And then they ask us to somehow compromise and have a trigger to let these insurance companies keep on committing these crimes and somehow set some kind of benchmarks to give them an opportunity to do right. They have been ripping off the taxpayers, the American people, the citizens of this country for far too long. No compromise should be entertained by anybody.
Yes, the idea was we could have triggers if the system doesn't work. The point is the system doesn't work right now. We've already met whatever triggers could be established. But let me ask you back about Attorney General Brown, with all due respect to what he's trying to do. Does our nation's healthcare problem, including the denial of claims, is that owed more to the fact that sometimes laws are being broken, or more to the fact that so much is actually legal and the insurance companies can get away with effectively murder?
Well, the fact of the matter is we don't regulate them in ways that would even suggest what their rates should be, whether or not they should or should not be denying claims. This is all within their power to do. They can take someone, again, who's been paying premiums for 10, 15 years on time, regularly, in one of these HMOs, whatever you want to call it, and they can decide after they do their own review whether or not to reject or to deny. We don't really have a lot of control over that.
We already know about the financial implications of this, and I hesitate to again use that incendiary term, death panels. But do people die, in fact, because of decisions made by insurance company executives?
We absolutely have stories. We have information from people who have had the experience that there have been deaths. As a matter of fact, there are several that were cited by the Nurses Association as they presented this information about young people who had been denied certain procedures and consequently died.
This request for the inquiry into WellPoint and United, that they coerced employees to go and oppose health care, even if they did, from the company's point of view, so what? What could possibly happen to the companies that would outweigh the benefits of creating these kind of fake public testimonials against healthcare reform?
Well, the fact of the matter is, if they have decided to treat their employees that way and to intimidate them and maybe even suggest in some way that they may not continue to be employed if they don't follow the company line, is something that we ought to be investigating. We should not allow them to do that.
Congresswoman Maxine Waters of California, as always, great thanks for your time and good luck as you continue your fight on this.
Thank you so very much.